back. Today we are joined by Dr. Ben Emery from Aspen Ridge Dental, and we're talking about sharing your medical records with the dentist. So why is that important? Most people wouldn't even think to relate the two.
Yeah, sometimes you need to relate the two because bacteria in the mouth can sometimes disseminate in the bloodstream and travel through the body, and bacteria can lodge in certain areas like artificial joints or the heart. And what we'd like to do is know what certain heart conditions are that a patient has so that we can pre-medicate them or provide an antibiotic prophylaxis for the patient.
Okay, and so when is this important? Is it before every time you go into the dentist, or for certain appointments, or?
I would say when you first go into the dentist for the appointment, for your initial exam, make sure you disclose that information to the dentist so that he may either pre-medicate you or may not pre-medicate you for your certain heart conditions. And some of the heart conditions that are recommended by the American Heart Association for pre-medication or antibiotic prophylaxis prior to dental treatments are artificial heart valves, congenital heart defects, certain congenital heart defects, heart transplant that has developed valvular problems, or previous history of infective endocarditis. And what we're trying to prevent is infective endocarditis, which is infection of the lining of the heart or the heart valves. And what can happen during certain dental procedures, for example, oral surgery or implant placement, some of the oral bacteria can go into the bloodstream, go to the heart, lodge there, and create problems with the heart.
Okay, and what could happen if a patient didn't disclose this information?
The patient could be at risk for infective endocarditis or infection around certain prostheses in their joints.
Which means what?
So if a person has had a total joint replacement by an orthopedic surgeon, that bacteria could cause an infection in that area, which can lead to serious complications, redoing of the joint, things like that.
Okay, and so if someone has been seeing the same dentist for years and they just recently either had a heart condition or a joint replacement, something you just mentioned, how important is it to tell the dentist?
Very important to update your medical history. Anytime you go to your physician or your surgeon and you have you change your medication, as simple as that, or if you certainly have a heart condition that they find. Now, one of the main concerns that we find nowadays is that the American Heart Association changes the recommendations all the time. The new recommended antibiotic prophylaxis does not include certain heart conditions that were previously treated, which are mitral valve prolapse, with or without regurgitation. The other one is rheumatic heart disease, bicuspid valve disease, and other defects like that.
Okay, and so for someone without any heart condition, would you also recommend them to tell you their medical history?
Yeah, absolutely. I think disclosing their medical history and information is very important for the overall care of the patient, not just working in the mouth, but making sure that we take care of the whole person and the whole body.
Okay, well, thank you so much for joining us today.
Thank you.
Well, up next, meteorologist Joe Hansel will have another check of your weather forecast, and if you're just joining us, your headline rewind. But first, let's send it over to NBC's New York studios for a look at what's coming up on the